Welcome to Discovering Health, presented by Covenant Health Plainview. Your host for the show is Chris Moore, alongside various medical staff and health-related professionals. For the next 30 minutes, Chris submits the questions to the professionals that you have emailed in and discuss the topics that you want to know about. Now it's time for Discovering Health, presented by Covenant Health Plainview and Chris Moore.
Hi, good afternoon. You're tuned in to 103.9 The Pulse. This is Chris Moore here. We are starting a brand new program called Discovering Health, presented by Covenant Health of Plainview. My name's Chris Moore, and today we've got in-house a couple of resident doctors. I'm so excited to get this thing going. First off, we've got Dr. Sergio Lara, who is over adult medicine, the trusted name on the South Plains for the last 12 years. Dr. Lara, thank you so much for being here with us.
Thank you. Happy to be here.
Also on hand, we've got Dr. Jessica Sherris, OBGYN here at Covenant Health Plainview for the last 2 years. Thank you so much for being here.
You're welcome.
Man, exciting stuff. I'll tell you what, folks, the way this thing works out is this. Each week, we are going to be taking in emails. So you email your questions here to us, to the doctors. We're going to have different doctors on each and every week right here on 103.9 The Pulse. We'll be going on hand answering questions, and these questions are going to be your questions. So please feel free, drop us an email, give us a call. We're going to be able to put this stuff right to the doctors. These are questions come from you, the listener, and we're going to get things started off right here with Dr. Lara. Again, Dr. Lara, thank you again for being here with us.
Thank you.
We've got this question coming in right now. Dr. Lara, here's the question. My father recently had a stroke a few months ago. I'm a 35-year-old man in pretty good health. I wanted to know, what can I do to reduce my risk of a stroke or a heart attack? Okay,
well, that's a very important question. Of course, we always worry about a family history that would put you at a greater risk of having problems like these. And there's a series of factors that we consider risk factors that you could have, that your father has also, that could put you at a greater risk. And we're talking about diabetes, high blood pressure, cholesterol, smoking, and several other factors that are important to discuss with a physician. So it's very important that you go to your doctor, and as much as you think that you're in great health, which I hope you are, it's still important to look for these conditions, as a lot of times in the early stages they don't give you signs, and they can be years after that you really have a problem.
Mm-hmm. So how often do you recommend then, Dr. Lara, for, let's say me, and I'm a little older than this guy, I'm coming in at 33. Thank you. Exactly. So how often do I need to come to the doctor, get checked out? As you know, and as he says, a 35-year-old, do I need to go get a regular checkup as far as blood pressure? And that?
Well, I think it's important to have at least an annual visit, just to have that culture of health and being evaluated. And in that first visit, when you go with your internist, family history is extremely important. And that's when you'll be asked a lot of questions about your family, mom, dad, grandparents, brothers and sisters. And based on that initial assessment, there's a different type of testing that we do for different age groups and for different risk factors. So most of the time after a first complete visit, we come up with a plan of how often we have to see you. Most of the time, if you're perfectly healthy and everything is good, we'll probably do one visit a year unless something else happens before.
Okay, very good. And then it doesn't hurt, if I'm waiting in line at one of the drugstores to get whatever medication, if I want to sit down, put my arm in the sleeve.
Yes, it's always important to be aware of your blood pressure. Most of the time, people think that you'll have a headache or you'll be dizzy if your blood pressure is high, but the reality is that a lot of times it doesn't give you symptoms, and you could have elevated blood pressure for many years before it gives you problems. So it's always important to be aware of your health.
Okay, very good. So, man, as long as we're getting that yearly visit, that yearly checkup, and then once we come see you, you could let us know, hey, look, I've seen this, I've heard about this in your family. Let's try to meet a little more often if we need to. And
that's the important thing. Everybody is different. Every case is different. And that's why you need to have your physician to guide you through the best screening and testing.
Okay, very good. There you go. Okay. All right. Dr. Sherris, we also, have another letter, coming in straight to you.
Okay,
all right.
It's a girl.
And it is. She is female. Okay. At least I'm guessing because she just found out she's pregnant. Okay. So.
Hey. My favorite part of my job.
Right, that's right.
Love pregnancy.
Okay. She just found out that she's pregnant. Okay. Well, actually, I'll read it straight from the.
Sounds great.
Dr. Sherris, I just found out that I'm pregnant. I just wanted to know, how much weight should I expect to gain and at what rate? And how does weight affect the pregnancy?
So It really depends on what your starting weight is. And so if you're a normal BMI, body mass index, then the average weight gain during pregnancy is about 30 pounds.
So 30 pounds over 9 months.
Over 9 months. You can't gain 30 pounds the first 2 months, then call it a day. You know,
Okay.
you got to spread it out a little.
Spread it out,
Tell
okay.
people you're not eating for 2.
Okay.
You're eating for like 1.25.
Okay, well, that's right, early on.
Early on, 'cause
Okay.
then we don't encourage dieting during pregnancy. So should you gain 30 pounds the first 3 months because you got a little overzealous, don't really want you dieting that down. So
Right.
I try to encourage my moms to make sure that, you know, in the first trimester, you may not feel very good that we're not losing weight, but you put on more of your weight gain towards the third trimester when baby's getting a lot bigger each week.
Yeah, it's kind of like a tick on the side of a dog, right? That dude starts swelling up, man. You just got to... Sorry, that was... Yeah, okay. Right.
We're not comparing pregnancy to ticks ever, I promise.
And
No
we're
way,
not,
not
and we're
at
not,
all.
we're not calling them parasites,
No.
right? These
Oh,
little
well,
ones.
you know.
They are little suckers,
It is
though,
a
right?
foreign
Just
body that we'll
suck-
remove at some
that's
point.
Right, that's right.
If you're underweight, actually, we encourage more weight gain because being underweight is a risk factor for preterm labor. So I do encourage, I have some really tiny moms out there, and I'm the one that's bugging them every visit. Hey, you gained a pound. Yay, I need you to gain some more. If you start out a little bit on the heavier side, a little overweight, we actually encourage women not to gain a lot of weight during pregnancy because being obese has its own set of risk factors for mom and baby. It can make your labor a little bit more difficult. So we encourage our moms to maintain their weight during pregnancy and gain maybe 15 pounds or so.
Okay.
So it's one of those, I think, a misconception that we all must gain 100 pounds during pregnancy, and it's tempting because the cravings are very strong. I've had 2 children, and oh man,
So you can relate.
I can
mean,
relate.
You've been there. You've done this thing.
my
right?
second
Yeah.
child's made of donuts.
Okay.
You know, to my OB-GYN, if you're listening, that didn't happen.
Right.
There's a local shop in town that knows me well, so.
Right.
But the cravings are strong. I do understand that. I'm a mom. I get it. But I do try to encourage my patients to stay healthy during pregnancy. It's important to have a good outcome at the end, and it helps labor to be active and healthy during the pregnancy. That affects our labor pattern towards the end.
Right, and I think right, all women carry it a little differently, right?
do.
Because there are those women out there. I remember my wife; she would look at one and go, "Oh my gosh, it just looks like she swallowed a basketball," you know, and that's all it looks like.
Yes.
And then you have others, you know, that I mean, like, you know,
Yeah.
their toes have picked up a pound each,
Yes.
and you know, it's like it grows everywhere.
It does. It took you 9 months to gain it. It will not take you 9 days or, a week or 2 to lose it. It's going to take a little while, and that's normal.
Sure.
You grew a human, so it'll take a little while to take that weight off, and that's a good part of breastfeeding and being healthy postpartum is to lose some of that weight.
That's right, because breastfeeding helps you to lose that.
Helps you lose weight.
All right.
Helps you bond with baby. Helps babies be healthier, not get it quite as sick when they're little bitty. So breastfeeding is very healthy for mom and baby.
Great. All right. Let's see. Next up, Dr. Laura, we've got another question for you. Lately, I have noticed that I have been urinating more than usual. Now, I would say, well, you're probably drinking too much. You need to back off your liquids. But this is why we have Dr. Laura here and not Chris, the
Giving the advice.
That's right, giving advice. That's right. Don't listen to me. All right, folks. We are listening to Dr. Laura. Don't listen to me. Anyhow, Dr. Laura, lately I've noticed I've been urinating more than usual. I've also been very thirsty lately.
Uh-oh.
Where I can't seem to quench my thirst. Should I go to the doctor?
Yes, absolutely. Many reasons for that, but the most concerning or likely one will be diabetes. Some of the early signs of high glucose levels in your system are an excessive thirst and also an excessive amount of urination. So those two by themselves need to be checked pretty quick.
Okay, gotcha. So, and what is the difference then, Dr. Laura, in just for those people that are listening, in type 1 diabetes and then type 2 diabetes?
Well, type 1 diabetes is a basically insulin-dependent type of diabetes. The most common diabetes that we see in adults is type 2 diabetes, which is more of a complex insulin resistance mechanism. In the end, the important thing is to recognize it. There's different ways of treating it, but the long-term consequences are what we're always after, trying to prevent those. So early signs of diabetes could be excessive hunger, excessive thirst, and excessive urination. And it's not just like, I think I urinated 1 or 2 more times today. It is really a very peculiar, excessive amount of thirst and urination and hunger.
Right.
And most of the time it's associated also with unexplained weight loss. People say, Doc, I'm eating a lot and I'm still losing weight.
And you're still losing weight, right? It's like the magic diet, right? Yeah, all of a sudden, type 2
Yeah.
diabetes, woo! You know,
It's a buzzkill.
Yeah. What a bummer. No
Yeah,
kidding.
sorry.
Right. So and then type 1 diabetes really isn't something that someone can change on their own, right? It's not
True.
It's not something that they can exercise and diet, right?
Yes.
Okay.
There's no question that diet and exercise are extremely important in both type of diabetes. Usually in type 1 diabetes, most of the time, and this is more in younger populations, they usually end up with very high blood sugar levels, very what we call volume depleted or dehydrated to the emergency room, and there's an absolute need for insulin at that time.
Let's talk more about this right after a word from our sponsors. More to come on Discovering Health.
Becoming a healthcare provider takes a special person. If you've ever dreamed of a career where you can make someone smile, keep someone comfortable, or soothe someone's fears, the Health Occupational Division at South Plains College can help open the doors to your future. With a stellar reputation for producing highly sought-after medical professionals, South Plains College is fulfilling the needs of tomorrow through its graduates today. And we provide our students with a quality education at an affordable price. Are you ready to make your dream a reality? Prepare yourself at South Plains College.
From keeping you healthy to ensuring the best journey into motherhood for you and your child, Dr. Jessica Sherrist is passionate about the health care of our South Plains mothers, daughters, sisters, and spouses. The only female OBGYN in the area, Dr. Sherrist is the perfect combination of knowledge and care when it comes to your gynecology and obstetrics needs. Visit her and her staff at the Covenant Healthcare Clinic at 2222 West 24th Street or call 806-291-5100. Walk-ins welcome and si habla español.
Surgical excellence is right here in Plainview. Dr. Yildiz and Dr. Raja with Covenant Health Plainview Surgical provides all aspects of general surgery to include abdominal surgery, surgical oncology, gallbladder surgery, appendectomy, critical care surgery, GI endoscopy, hernia surgery, and so much more. Professional and caring doctors right in your own backyard. That's Covenant Health Plainview Surgical, 806-296-7881. Welcome back to Discovering Health. If you're just tuning in, we are here with Doctors Sherrist and Laura, and we were discussing diabetes. Dr. Laura, what do you see a lot of?
What we see more in adults is, as you were saying, a combination of things that lead to insulin resistance, which a lot of times have to do with lifestyle. Obesity, lack of exercise,
Donuts.
poor diet, donuts, as Dr. Sherrist tell us. And so it is extremely important to be seen by your doctor. And
Right. Go in there, see the doctor.
Absolutely.
He'll put you on the right medication. If
Yes.
needed, he will put you on the right
Yes.
diet, the right exercise. That way,
Absolutely.
we're not eating bags of chips and donuts and that
Absolutely.
kind of thing, but a little more
Absolutely.
healthy.
And we need to address those problems immediately. There's a lot of fear when we talk about diabetes, about end-stage renal disease and dialysis and losing a limb and losing your vision or having a stroke. And those things happen. And they happen more often than they should after many years of diabetes that's not being well controlled. So it's extremely important to take responsibility, diagnose these problems in time so that people can have a life as expected with very good quality of life without all these consequences.
Right. Very good. Very good. And especially, like you said, losing limbs and that kind of stuff. I mean, you see that a lot, because the circulation gets cut
Yes.
off. The blood's not reaching the extremities. And
believe it or not, people can have, or there can be years go by before someone goes to the doctor. And a lot of times that's a very difficult part when we see someone already suffering from the long-term consequences of diabetes, that there's really not much you can do for that. So.
And again, like Dr. Laura said earlier, as long as we're able to get to the doctor once a year, like we're supposed to, they can check those blood levels.
Absolutely.
We can check those levels, make sure everything's the way it needs to be, so we can nip something in the, what is Barney Fife, right?
Nip it in the bud, Andy. Right? Gotta nip it, nip it, nip it.
Right, okay. Anyhow, sorry, it's me messing around. Okay, perfect, doctor. Thank you so much for that. All right, Dr. Sherrist, what do doctors test for during a Pap smear?
I feel like there's a lot of misconceptions about the Pap smear. Just because you have a pelvic exam does not mean you have a Pap smear. A Pap smear is actually we take a little brush, we take some cells from the cervix.
Okay, explain to me, because I'm a dude. I'm clueless on the brush. I mean, are we looking at a toothbrush? We're looking at a paintbrush. What are we looking at here?
It's a little tiny, little broom type brush.
A little
bitty.
broom.
Yes,
Okay.
very small, very
like
harmless.
a push broom. or like a?
No, like a little plastic.
Okay.
A little tiny little brush.
Okay.
The cervix is the opening to the uterus that dilates when you have a baby.
Okay.
So that's what we look at during the exam. We take some cells from that area of the uterus and we send them off to pathology. We actually have new technology now. It's a newer test that's been developed, and we look for the cells to be normal or abnormal. We also look for HPV, which is human papillomavirus.
Okay.
We have figured out in recent years of research that this is a little pesky virus that hangs around and causes cervix cancer. And so we now have the ability to test for that virus to know that, oh, you're a carrier of this virus. We should probably do some more testing on you to see if there's any problems. And so we do that testing on women over 30. We don't do that test on women who are under 30. And so those are new changes in Pap Smear guidelines. So it's an ever-evolving science.
Sure. So we're going in and we're looking for HPV.
Yes.
Right. And then what? And is there anything else that we're looking, like any kind of abnormal cells?
Abnormal
and
cells.
that kind of thing.
Yes.
So where something comes up to where we're worried about cysts on ovaries or
No, you can't see the ovaries.
Okay, we can't see
we
ovaries
can only see the
on
cervix.
Okay, only
So
cervix.
ovaries on the inside. And so we're just looking at the opening to the uterus, the cervix. And so if those cells are all normal, then the likelihood of having cervix cancer is very low.
Okay.
And it predicts that if the HPV is negative, it predicts that in the future, much less likely to have cervix cancer in the near future, because cervix cancer actually takes about 12 to 15 years to develop. It doesn't happen overnight.
Okay.
And so that's why we have people come in, like you said, every year to have exams and to talk to your provider and to see if you're eligible for a Pap smear. And if it's time for one, then we would do one. It's a very simple test. People are always afraid of it, but it takes very little time to do and tells us a lot of information.
Okay. And then how often do you recommend having this Pap smear done?
They actually changed the guidelines. They used to be every year. That's what a lot of women used to have to do. They actually changed them around the time that I started training, and now it's every 3 to 5 years.
Oh, okay.
Yes. So, but doesn't mean you can't skip your annual visit with me. You got to come every year.
That's right. Still come. That's right. You still got to
Come
get a
say
paycheck.
hi.
That's right. You still got to get a paycheck.
Well, we got to talk about birth control, talk about everything else, make sure we're doing good. And so it just depends on the patient's personal history as to what I choose and decide on the next Pap smear. There's a set of guidelines that we follow.
Right. Okay.
So it's
All right.
individualized.
It's just like meeting with you. Yeah, with family background and history and all this stuff.
Yes.
Because I'm guessing with the Pap smear, as you find things and this and that. Well, what's your history? What on your mom's side of the family? What are we looking at? Right?
Yes.
I'm guessing.
What's your Pap smear history?
Okay.
Things like that.
Sure. All right.
So.
Great. All right. Super. All right, folks. We've also got another question here for Dr. Laura. The next question for Dr. Laura is as follows: what are some of the causes for feet swelling? All right. I guess this person has swollen feet. Is it serious? And does this person need treatment?
Well, there's many different causes. Depends also on the history, age of the person, medications that they might take or not. It's not normal to start with.
Okay, so if you wake up in the morning, you've not been, you're not waiting
You're not
tables,
pregnant.
you're not on your feet all day, walking around and everything, you've had your feet up all night, you wake up and you can't fit your, foot into your slipper.
Yes,
What's
so
going on?
That's the most important thing to realize that is not normal. There might be some situations in which you're on a road trip, or as you say, you were standing all day at a church event or something like that you might say, well, I had a little bit of swelling and it went away. But the reality is that it's not normal, and it's important to be checked. It could be a medicine that could be giving you that side effect. Some blood pressure medicines could produce it. It could be venous insufficiency as well. Age or veins don't work very well, or they lose some of their function, and some blood can pool down in the legs, and that can produce some swelling. But also there are things that we need to consider, like problems with your kidneys, problems with your liver, that are important, even problems with the heart that we call heart failure, that there's many different types of heart failure, but that they need to be checked.
Okay.
So the important thing is it's not normal.
Okay,
it's not normal. And many different reasons, and that's why it's important to go and make sure that you get that checked.
Okay. Great information. Let's hear from our sponsors and then return for the last segment of Discovering Health. When you need a trusted name in medicine, Dr. Sergio Laura is here for you. For more than 12 years, Dr. Laura has specialized in providing the internal medicine needs of our local friends and neighbors. His experience and knowledge of adult medicine has kept Dr. Laura at the forefront of West Texas healthcare. Visit Dr. Sergio Laura, one of the most trusted names in West Texas, at 2606 Xenia Street, or call 806-291-5120.
The Technical Education Division of South Plains College can help you get into a career in as little as 1 to 2 years. If you want to work in business administration, law enforcement, cosmetology, real estate, or the legal profession, a job can be yours in a short period of time. If your interest is in software development or network technology, that dream can become reality. South Plains College provides our students with a quality education at an affordable price. Explore these career opportunities and many more today. Prepare yourself at South Plains College.
We're back here on Discovering Health, and I have a question for you, Doctor. I'm sorry, I'm inquisitive, man. I'm learning stuff because right now I think my feet are swelling up. Just as I sit here and talk. No, I'm not a hypochondriac. I'm really not. I'm really not. Honestly, I don't go to the doctor.
I can tell you though, you're not pregnant, so it's not that.
Okay, you can tell by the facial hair, right? Yeah, just does something,
diagnose
right?
that.
Very likely.
Sure. Okay. So if it's trouble with the kidneys, what possible problems could it be with the kidneys? What?
There is different situations in which the kidneys by themselves could slow down their function.
Okay.
You know, they're filtering and they're cleaning of blood, but there's also conditions in which your kidneys can lose an excessive amount of proteins, and when you start losing proteins, you will have a tendency to have that edema that we call, or swelling.
Okay, so it's similar to, because I know some folks, like when they have a few too many drinks, let's say, all right, maybe with salt, too much salt in the diet. I know that my wife will say, oh, I can tell that I had too much salt last night because I can't get my wedding band off or on, or yeah. Well, it's always off. It's never trying to get it on. She does take it off. Easy, doctor. All right. So a lot of that's like salt intake.
Yes.
So if we go to a ball game, Rangers game. Okay.
We're at the Rangers game.
All right. So
eating a hot dog.
All right. So Dr. Laura, I go to a Rangers game. I'm up there. I'm clapping for my team. Whether it's the Rangers or whoever we're playing, and I have 3 of those foot-long hot dogs with extra chili and cheese and a couple of cold drinks. The guys that are yelling it from the stands about cold Budweiser and whatever. Oh, I've had too much salt. That can also be a problem.
Yes.
Is that right? Okay.
Yes.
But
should go away pretty quick.
Okay, which should go away quick. Now, if it
In a healthy person,
in
a healthy person, that has nothing to be worried about. But in the end, the important thing is never assume that something like this would be normal, and never just sit and wait for it to go away. Because the tricky part is that it can go away and come back, and go away and come back, and you might be losing precious time that you need to be evaluate and make sure that that's not something that could have consequences.
Right. Okay. All right. Very good. Thank you, Dr. Laura. All right, Dr. Sherist. Okay, I got another question here. Dr. Sherist, when's the best time to start seeing a gynecologist?
So,
and by the way, you're married. So we're not talking about asking you out.
No.
We're talking about going on a visit, on a doctor's visit to the doctor. Now, this isn't the dating game or anything, folks. So
I've got 2 small children, a lot of baggage. People see it, they probably see me and run. It's okay. I'm okay with it.
All right. So for a young lady, all right, I'm just going to say, for instance, speaking of young ladies, I have a 14-year-old daughter.
Yes.
All right. She just turned 14 in July.
Yes.
And I'm thinking, okay, when do I take her this year? Do I wait a while? And I'm asking the doctor now, when's the best time to take a little one to the...
To be sadly and bluntly honest, either 21 is when we start our Pap smears. That's the age that we should start our annual Pap smears, or at least every 3, and start talking about that. Or when there's ever a concern about a risk of pregnancy with sexual activity, or there's a problem with your periods, things that I can fix. And so I am more than happy to meet teenagers and say hi and give them a good feel for what it's like to have a gynecologist take care of you, and that I'm not so scary. I think people hear gynecologist and they're terrified of me.
Okay.
I see that a lot. And it's just me. Here I am. I'm really not that scary. And my goal is to be a safe harbor for women to come to for care and feel like they can trust me and tell me their concerns, their problems, their worries, and that they will get great care while they're with me and at their comfort level.
Okay, very good.
21 or whenever there's problems.
So at 21 or whenever there's a problem.
Is when we start our Pap smears.
All right.
So, but if beforehand, if there's ever a concern, I see a lot of young women that have problems with their periods and they're unhappy, and that's fixable. We can totally fix that. And so I try to be, very open and honest and friendly with people, and I don't always require pelvic exam, so we can be open to that.
So just coming and just talking to you.
Meet and greet, make sure that,
getting to know you. And
yes, and I'm a big encourager, proponent of the HPV vaccine for girls.
Okay.
So we can talk about that, make sure that, everything that we're talking about, our health and general OB-GYN maintenance issues.
Sure.
So.
And on the HPV virus and on the
Yes.
what are some signs? And I'm just backing up to what we talked about earlier. What are some signs of that HPV virus? And I know sometimes it takes a long time to be able to see anything from that.
Right. This is the problem, is that it is usually asymptomatic. And so that's why we are starting to vaccinate our young children against that. Men don't have cervixes, so they don't carry any symptoms, and then they pass it along unknowingly to their partners. And women will have this pop up on their Pap Smear or during an exam if there's a mass or a problem on the cervix, and that's when we find out. So that's why we do the Pap Smears, and that's also why we encourage the vaccination, since it's asymptomatic in most people. HPV also causes genital warts, so that can be a symptom of men or women. But for the most part, most infections are asymptomatic, and there's no cure. There's no medication you can take to make it go away.
Okay.
So prevention is key.
Okay, very good. And like you said, you're a big proponent for the vaccination.
Yes,
we see a lot of stuff on the television shows and the commercials promoting it, and then then we hear vaccines. Vaccines are bad, and then now I'm going out and buying chicken that hasn't had an antibiotic, and but then I have antibiotics. Does that make me bad? Or all the stuff that goes with that.
Well, I tell people all the time. You don't hear people on Facebook, I got my HPV vaccine today, and I'm so excited. You hear all the horror stories because that's what people are going to advertise, but you don't always hear the good stories. And so we're actually having lower rates of cervical cancer because of the vaccine introduction. So it's a good thing. And it's important we vaccinate boys and girls. And that's a common lack of knowledge, is that you can actually vaccinate boys as well, because boys are asymptomatic carriers that pass it on to their partners. So it's important that we get our sons and daughters vaccinated.
Sure. And what is the age of getting our kids vaccinated for that?
Down to, I believe, age 9.
Okay.
And so it's very young, and the top age we stop giving the vaccine is 26. So there's a very wide range. So a lot of children actually end up talking to their pediatrician or their family medicine doctor and get vaccinated through that route. So I see a lot of kids that come to my practice that have already been vaccinated, but I always double check with women when I see them if they're in the age range to receive it, that they have either received the vaccine or received information about it.
Okay, great.
So I'm very pro HPV vaccine.
Okay.
Try to prevent cervix cancer.
Very good. And this coming right from the mouth of the doctor.
Yes.
Folks, that's right.
I have a lot of women that come through that have abnormal Pap smears, have to go through a lot of extensive testing. It's uncomfortable. And, once they hear about this vaccine, they're like, why didn't I get that? And then we talk about, well, vaccinate your daughters, vaccinate everybody
Sure.
Prevent having to go through this unfortunate circumstance. So.
Great. Well, thank you. All right,
You're
folks,
welcome.
we are listening to Discovery Health right here, presented by Covenant Health in Plainview. My name's Chris Moore. On hand today, we had Dr. Sergio Lara, out of adult medicine, the trusted name on the South Plains for the last 12 years. Also on hand, Dr. Jessica Sherrist, OBGYN here at Covenant Health for the last 2 years. And great to have those folks on hand. Dr. Sherrist, we can see at Covenant Healthcare in Plainview, located at 2222 West 24th Street here in Plainview. You can also give her a call. This isn't her direct line,
Give me
her
a
cell
shout.
phone. That's right.
Please don't Facebook message me. I won't answer.
Yeah, no Facebook messages, right? No texting, right? But her office number here, folks, is 806-291-5100. Again, that's Covenant Healthcare in Plainview, 2222 West 24th Street in Plainview, 806-291-5100. And also, we've got Dr. Laura here out of the Edgemere Clinic. He's located at 2606 Yonker Street here in Plainview. You can give them a call, set up a time to come by and visit him. His number, 806-291-5120. Again, folks, this has been Chris Moore with Discovering Health, right here on 103.9 The Pulse.
You have been listening to Discovering Health, presented by Covenant Health Plainview, with host Chris Moore, and exclusively on 103.9 FM The Pulse. Do you have a specific problem or question that you want discussed? Email your question to askforyourhealth@gmail.com. And listen in every Wednesday at 5 p.m. for Discovering Health, presented by Covenant Health Plainview. The information discussed on the show are for informational purposes only. The purpose of the show is to promote understanding and knowledge of various health topics. It is not intended to be a substitute for diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment. Thank you for listening to Discovering Health on 103.9 FM The Pulse.